Welcome everyone to the Gender and Health Hub virtual forum, Evidence, Voice, Action, Catalyzing Change for Gender Equality in Health. Before going further, I wanted to acknowledge the wonderful musician, Sona Jobarte, whose music you have been listening to. A singer, composer, educator, activist, she is a pioneer and trailblazer in her own right. So welcome again to this, the third and last session of 3 in the 2023 virtual forum. My name is Sagri Singh, and I serve as the Chief Gender and Health at the International Institute for Global Health, which hosts the Gender and Health Hub. We are a UN-affiliated think tank focused on evidence to policy translation in global health, working closely with partners across the globe. A key stream of our work and a focus of the Gender and Health Hub is to explore and distill how gender equality issues are integrated into health and programs, policies and programs, and what works and what doesn't work. Our session today will focus on gender equality and health in the time of polycrises, breaking silos, collective action. And we are particularly delighted to be co-hosting this session with the People's Vaccine Alliance, the Pandemic Action Network, PATH, and the African Community of Practice, a collaboration of the African Union Commission on COVID-19 Gender and Stigmatization Working Group, the University of Western Cape, the School of Public Health, the Institute of Global Health, and PATH. Today, we are witness to multiple economic, environmental, social, and political shocks that have converged, driving and deepening existing inequalities in gender and health. And simultaneously, our evidence suggests that there has been a tremendous backslide in democracy across the world related to pushbacks against gender equality and human rights. The situation, we all know, demands new and innovative policy approaches and collective action and allyship to global development and solidarity building. This includes critically engaging questions around how responses to current crises support gender dimensions of recovery and resilience for future efforts, and how preparedness plans must center intersectionality and gender equality considerations in priorities, in investments, and in decisions. As COP28 deliberations are ongoing and highlighted on every platform, a UN Women study recently noted only 3% of climate finance is dedicated to gender equality. I marvel at the disparity, as I am sure many of you do, between the impact of these disruptions on the lives of women, girls, gender diverse individuals, and marginalized communities, compared to the investments dedicated to leveling the playing field. I applaud the leaders, the activists, the advocates, and practitioners for raising the centralization of gender and intersectional issues in the climate response during a dedicated Gender Equality Day. And I also, like I'm sure a lot of you, look forward to the day when gender equality is central to all conversations, part of openings and closings of these high-level meetings, and an integral ingredient to the success of development and the mitigation of the crises we all face. In this session, we convene a space for dialogue with actors from different sectors, deliberately bringing together a spectrum of perspective, experiences, and expertise to break down the silos and foster pathways to develop inclusive and innovative solutions. Today's session is in webinar mode, but we really want to hear from you. Please put your questions for the panelists in the Q&A section, and please share your thoughts, your experiences, and your expertise in the chat function. If you find any discussion points interesting, please feel free to share it on social media with hashtag GHH Virtual Forum. It is now my distinct pleasure to introduce Kate Gilmore, who will provide some framing remarks for the session and serve as its moderator. Kate is an Australian human rights advocate with a distinguished career in advancing social justice and equality. A former UN Deputy High Commissioner for Human Rights, Kate is a professor in practice with the International Development Department of the London School of Economics and Political Science and chair of the board of the International Planned Parenthood Federation. Among her many other roles, she is also a co-chair of WHO's Gender and Human Rights Advisory Panel on Human Reproduction and a member of their Immunization Agenda 2030 Partnership Panel. Kate, over to you.
Dear Sagri, thank you so much for your leadership, for the wonder of your introduction, for the gift of this forum, and importantly, for the gift of this wonderful panel. Dear friends, thank you so much for joining us. It's, after all, such a cursed time in which we meet. It's not only the cursedly current atrocities of those held hostage, of those blown apart, sexually assaulted, maimed, displaced in today's multiple, indiscriminate and disproportionate conflicts, or the atrocities too of public policies making graveyards for untold thousands from the waters of the Mediterranean and the Rio Grande. It's not only the atrocity that a woman veiled should be denied civil rights, that a woman unveiled should be denied liberty, that undergoing spontaneous miscarriage, a pregnant woman should be denied by law life-saving medical care for fear the termination was induced by choice. But it's also the atrocity of inequalities so deepening and so broadening under unchecked capitalism that Oxfam's 2020 report found the world's 22 richest men own more wealth than all the women of Africa combined. It is the atrocity that sees whole countries disappearing under the rising tides and relentless desertification of a consumption-driven, extraction-caused climate collapse that in less than 50 years has caused the loss of 69% of the world's wildlife. Man-made catastrophes in unrelenting reproduction, it seems, for the sake of incomprehensible profit. 6 of the Fortune 500 top 10 corporations globally being oil and energy companies, companies that last year pulled in record high revenues. The world is awakening, perhaps, to the threats of ungoverned artificial intelligence and of new pandemics once again mismanaged. But how is it that we are not yet troubled on the same scale, to the same extent, by the unconscionable costs and consequences of greed and its constant playmate bigotry? Friends, in this world of polycrises, conflict and contagion, climate collapse and corruption, what are we to do with our demands for equality and justice? What might equality, and specifically the norms, standards, and substance of gender equality, intersectional, intergenerational, international, what might those norms, standards, and substance offer in terms of constructive disruption? That is the focus of our panel today. How can we use a gender lens, a gender analysis, and a gender demand to create constructive diversion away from these pathways leading to the disaster of multiple disasters? Or, to borrow just a little from the late, great Miss Tina Turner, what has gender got to do with it do with it, do with it. I shan't sing. Fortunately, what we have instead is a wonderful, wise, and challenging panel to extend and challenge our thinking. Experts in humanitarian response, donor relations, researching environmental justice, climate action, and in health. A fantastic panel to help us probe, push, pummel our confrontation with what mayhem means for inequalities in gender and in health, and what might be pathways, equalizing pathways, dignifying pathways through address of gender inequalities, pathways forward for new directions and for more just, inclusive destinations. Our first question of our fabulous panel, if I might, goes to Dr. Fifa Rahman. The fantastic thing about Dr. Rahman is she's a principal consultant at Matahari Global Solutions, and she is experienced. She's proven and tested, having worked in global health over a number of years. She's focused on strategic engagement and amplification of global South expertise, including via qualitative research and the convening of actors, stakeholders for the sake of strategic intervention. And she's also an expert in evaluation. FIFA, if I might invite you to take the floor and to tell us, from your standpoint, what are the implications of gender equality and health in this mayhem of a polycrisis world? Thank you so much for joining us. Over to you.
My pleasure, and thanks so much, Kate, for that introduction. I work predominantly in the pandemic space, and what we saw in the last pandemic and what we will likely see in pandemics to come, unless we make a major shift in ways of working, is a siloization of expertise. And in the pandemic world, we see a lot of emergency experts working, and there are several problems with this rigidity in expertise. One example is a situation in Afghanistan where we know where women can't really walk around or access healthcare without the accompaniment of a mahram or a male guardian, in other words. And at the start of the COVID pandemic, when vaccines were being rolled out and COVID-19 information was being transmitted, for some reason, the international agencies present in Afghanistan provided the information through digital means. And this was disregarding the information or the data, the clear data, that only 35% or less of women in Afghanistan have access to digital skills. And that's not just confined to phones, but it's also confined it also pertains to radio and TV and other things like that. So what happened is women were left out of receiving COVID information, much less being able to access COVID vaccines. And this was a decision made by global health agencies who really should know better, but didn't because of the siloization of expertise. And in addition, very quickly, is the situation in DRC, the horrors that we are seeing with murders and indiscriminate violence being overlapped with climate issues and flooding and displacement. Many people affected are women, and we are really not seeing enough spaces where we see a conglomeration of expertise exist. So I suppose in conclusion to my short intervention for this first question is that we're not seeing enough multidisciplinary spaces, and that's a real problem.
Fifa, thank you so much for the wisdom and the challenge, actually. It's so pertinent to the UN University and its encouragement of synergy across expertise and perspective. May I turn to further our understanding of this question about the implications for gender equality of a world of polycrisis. May I invite Sarah Hussein? I know, Sarah, we only have you for a small time. I feel embarrassed even to introduce you. It seems so unnecessary. But she's the most fantastic human rights scholar and lawyer. She has been a tireless advocate in her own country of Bangladesh and for the interests of justice and equality in the region. But she's been appointed to some of the most important responsibilities by the UN Human Rights Council. Most recently, she's chairing the UN fact-finding mission on violence against women in the context of the 22 Iran protests. Sarah, it's honestly such a wonderful privilege to have you with us. Your standpoint on gender equality at this time. Over to you, ma'am, and thank you so much.
Thank you so much, Kate. And thank you so much for your introductory remarks, where I think, you really highlighted the need for us to speak out and be aware of the atrocities ongoing in the world today. I think for me, that's the biggest takeaway when we speak about polycrises, that we have to be really aware of the linkage between, or not the linkage, the absolute critical necessity of upholding universal norms. And I think the apparent stepping away from the application of universal standards and universal norms by much of the globe at the moment in the context of ongoing conflict and our inability to name it in many spaces is actually the most serious thing that we're facing, because we all rely on that universal framework, whether we're working on the ground in local communities or whether we're working in global spaces. We can't afford to have that fracture, and we can't afford for it to lose more respect from people. We know that whenever we work, in our work, for example, you kindly mentioned my work with the UN fact-finding mission. As we're reporting later this year, I don't want to speak about our conclusions there, but I do want to mention the challenges we faced in our work, which is not having access to the country, not being able by the government concerned, not being acknowledged by the government concerned, being denounced, and not being given access to the people of the country. That's not something that we alone face in this fact-finding mission. Those working all over the globe, whether it's in the context of Israel and Palestine, which is in front of the world every day in our screens, every moment today, or whether it's in my own country or elsewhere, this issue of non-cooperation, non-access sits very unwell with people speaking about global cooperation, whether it's COP or paying lip service elsewhere. So I think we have to call it out. We have to name names. We have to speak out. And I think that's the first challenge for us. But I think the other one that I wanted to mention is when working particularly at a local level, when working with those who are affected as we do, through legal services organizations and women's rights organizations, addressing, for example, issues of domestic violence, child marriage, which increased at a rampant level through the pandemic in particular. We saw at that moment, paradoxically, a real coming together, working across disciplines, as Dr. FIFA was saying, using digital tools, being aware of their opportunities, as well as, of course, being exposed to their risks, but also learning about how we had to focus on the most vulnerable and what we needed to do to get there. And I think what's disturbing is in a post-pandemic world, maybe the next pandemic world, that maybe we're not learning all of that lessons of that cooperation that we had. First of all, in terms of understanding the need for continuing a multidisciplinary approach, but also in terms of bringing together civil society, communities, and working together with state agencies. So that cooperation is what we really need to build again. And I think that's the challenge for us. We need to do it in the context of respect for universal standards. And I think, as you rightly said, another very difficult thing for us to talk about, addressing the democratic deficit, seeing how we build democratic communities and democratic structures and push back against the erosion and push back against this notion that we can have development in the 21st century without democracy. It's not possible. It may look like we're getting it at the beginning, whether we have women leaders, young people, or whatever, they have to subscribe to those norms, and we have to accept that we can't step back from them. It's not okay whether we do it in the name of one religion, one community, one ethnicity, or in the name of nationalism or whatever it is. But I think that reassertion is necessary for our resilience, for resistance, and for moving forward to establish rights in the way that we've always struggled for them. We can't step back. That would be my message.
Sarah, thank you so much. I think Sarah has reminded us so powerfully of the tools we have at our disposal. That's what norms, the rule of law, the international standards, they're tools, they're equipment to put in our kit bag to carry forward. But she's also challenged us, as indeed we've already been thinking about, thanks to FIFA's intervention, to collaborate, to cooperate, to synergize. And I'd like at this point to bring in Adil Iman, who's a fantastic environmental justice activist, a climate change champion, working directly in the context of the challenges lying between climate action and protection of biodiversity in Malaysia. He's a youth leader. He's an agitator. He's stubborn and he's very determined. But Adil, when you think of this from a younger person's perspective, what do you see as the critical challenges specifically for gender equality and this need to join up our demands somehow, to find synergy and cooperation rather than perhaps specialization? Over to you, Adil.
Thank you so much, Kate. It's such an honor to be here to speak about this really important topic. And I think one of the challenges that young people faced in terms of climate action is tokenism. I think that's really apparent nowadays. We're seeing huge amount of young people being tokenized at COP, at conference or parties under the UNFCCC. We are seeing them being tokenized in different climate change advisory panels at national levels. So it can be a demotivating factor for climate change activism when you're just invited to a panel session, to a meeting for photo sessions with a minister, right? It can be really demotivating in that sense. But I also want to highlight this really important nexus between gender and climate change in the context of children as well, and the state of marginalization of how children in Malaysia are more impacted by climate change compared to adults. In fact, in 2021, UNICEF Malaysia collaborated with the National University of Malaysia, with other think tanks to produce a report on the impacts of climate change, a Malaysian children perspective. And we found that young girls in different communities, especially in indigenous communities, are more vulnerable to climate change effects. We see that these young girls are dropped out of schools when resources become scarce in their households, when those households are impacted by flooding, impacted by droughts, by heat waves, by other climate disasters. Girls tend to be the ones to be dropped out of schools. But at the same time, we're also seeing the sense of safety being threatened there when young girls in Malaysia living in households that are very vulnerable to climate change effects, such as heavy rainfall or heavy storms, tend to feel more unsafe than boys. And this heightens when there's the case of sexual abuse, when there's violence in that household. So there is that, well, we acknowledge that children in Malaysia are more affected by climate change impacts. There's a disproportionate scenario as well when it comes to boys and girls. I think building resilience is important. At the same time, it's worth acknowledging that these gender dimensions come from cultural aspects as well, especially in indigenous communities in Malaysia, where, like I mentioned before, they are usually the individuals that are dropped out of schools, and the boys in the families are the ones given the opportunities to pursue education while the girls are left behind. And these households are being impacted by their agricultural production are affected by droughts. Their households built on really not sustainable materials are damaged by climate change impacts. So in this context, we see when it comes to young people and children, there is a gender dimension. But I also want to move forward from that as well and see other issues specifically in in Southeast Asia in terms of LGBTQ communities, of how the state of discrimination or existing inequalities exacerbate their impacts of climate change as well, on how especially sex workers, those queer people working in informal work are more vulnerable to heat waves, to flooding and so on, and they're not receiving enough information because of that state of discrimination and marginalization.
That's brilliant. Thank you. And Adila, I'm going to come back to you actually to talk further on those issues, because that you've opened up so many brilliant directions for the conversation. But just with your kind forgiveness, I'm going to bring in Dr. Stella Bossir now. Stella, if I might just say this, I think you embody the synergistic thinking we're looking for. Somehow, you are a doctor, you are a lawyer, you are a researcher. It's exactly the combination of knowledge, expertise, and commitment we need. You've a phenomenal background in health and in global health, but also as a founder of the Africa Center for Health Systems and Gender Justice. It's a pioneering institution dedicated to exactly what we're talking about. What has gender equality got to do with it, Stella? And thank you so much for joining us.
Thank you so much. It has everything to do with it. It has everything to do with how it is that we reallocate resources. It has everything to do with how it is that we talk about leadership and power. It has everything about how we look at intersectional issues that affect women, gender diverse person, and vulnerable populations within our communities. And so every time we talk about health equity, one of the things that one of our weakest points, a blind spot, if I may call it, and which are some of the lessons we learned during COVID-19, is that the biomedical interventions are not enough. As a medical doctor, I came to that conclusion, and it's a conclusion that the world needs to be able to come into it. I'll give you an example of one of the struggles that we are having around the continent around vaccine hesitancy in HPV. You know, just the whole continent, we have less than 33% in terms of vaccine coverage. And yet we know this is the one cancer that can really be prevented. But the approaches that we continue to use are biomedical approaches, you know, without thinking about what are the other social determinants of health that really influence how women and girls are able to attend facilities, are able to access this vaccine. So we don't think about the issue around distance. We don't think about women economic power. We don't think about women's voices within households. We don't think about women's buying capacity, you know, purchasing power. We don't think about those factors, and yet they are very important. And finally, we don't even think about deeply about the cultural norms, you know, within the society where women are situated. And yet they have a direct implication on the uptake of some of our amazing innovations within healthcare. The other thing that we don't also deeply invest in, and we keep talking, and I like that we've already said that there's a lot of lip service, you know, going on right now. People are in COP, you know, and they will come up with, oh, we are going to do a carbon taxation. They do they'll talk big things, but then at the granular level, when you start thinking about the interconnection around what's happening in climate crisis, if it's the floods, if it's the wildfires, if it's a displacement, you know, all those things that are happening, and also the changes in disease patterns, you know, that is happening affects mostly the poor people, women, the elderly, you know, and those who cannot be able to access care. So unless you have a gendered lens that actually looks at things from a 360 degree, then you cannot actually now connect why it's important for all of us to have hands on deck to be able to respond to climate crisis because of agricultural issues, food security, you know, because malnutrition has been a problem in the world and continues to be a problem. And now it's going to be really worse, but it's going to be worse among children from poor families. It's going to be worse among teenage and adolescents who already have a very high burden of iron deficiency anemia. And so we have to really start thinking about how do we translate some of the things that we talk about, some of the disease processes, some of the public health interventions from a perspective of looking at an intersection. And I love the feminist ideology as a feminist, because not one thing is singular faced. It's actually multiple faced. And so it's critical for us us to be able to connect the dots and to speak to each other and to work holistically to be able to find solutions to the vast issues that are affecting women, gender diverse person, and those who are marginalized within different communities. I will give you another example of some work I did.
Stella, do you mind if I just bring in one more voice and then we come back to you?
Fantastic.
Is that okay? Because that was so brilliant what you've said,
Yes.
and you've already deepened and extended our understanding. Thank you so much. And you're all going to find me so irritating, I know, and I apologize. But I just wanted to bring Dr. Sam Oti to the floor at this point. Sam, if I may, you are one of the leaders at Canada's International Development Research Centre, operating from the continent, from the African continent, from Nairobi. You're playing a leading role in IDRC's global health initiatives, and thinking about this from an investment and financing standpoint. Having listened to colleagues thus far, how do you see globally gender equality being positioned in this world of polycrises? And Sam, thank you so much for joining us. We're very honored. Thank you. Over to you.
Thank you very much, Kate. It's really a privilege to be here. And a disclaimer, the views I'm about to express are mine and mine alone. Now, as you said, I work for a funder and I work with groups of funders. And we all know that funders have an outsized influence on the practice of international development and global health. So I feel obligated to focus my intervention on what a polycrisis world means for funders who are hopefully trying to address gender and health inequalities in the world. I think that the standout implication for funders, majority of which, for better or for worse, are domiciled in the global north, is that the game is over. The game is over. Yes, as funders, we are doing a lot of great things in the world, but we cannot continue with a business as usual funding model, a model that is top down, that tends to be short-sighted, that creates and enables dependencies, especially in the global south, that is reductionist and siloed, and that often fails to sustainably empower local communities and vulnerable groups. This model just simply cannot withstand the multiple and intersecting crises that the world faces today. Case in point, we all know about the funding cuts that occurred in the aftermath of COVID, and before that, the migrant crisis in Europe. So it's easy for anyone to see how outdated this predominant funding model is for global health and for international development, how outdated and unfit for purpose it is. But I'm not sure that most funders realize this. So it will be up to all of us to call them out, to call me out. Right. For example, when the UK government announced aid cuts in 2020 in the aftermath of COVID, I think the CEO of Save the Children UK didn't miss any words. She was like, she said that it was a death sentence for thousands of children already living in some of the most dangerous parts of the world. So the game is over, and funders need to embrace a new funding paradigm that is fit for purpose in this polycrisis world. And I'm happy to share a few ideas about what I think funders could do to adapt to the changing world. Back to you, Kate.
Sam, that was superb. I don't know if you were able to see how many people were nodding their heads and so delighted to hear you speak in those terms. May I just go back to the panel then, taking advantage of the nourishment already provided. You've spoken about these gendered dimensions, not only to assessment of the consequence and the injury of these polycrises, but what gender equality can mean for resilience, for reparation, for remedy, for redress. But we've spoken about the silos that prevent perhaps us realizing that potential. If I could start with Sarah, and I'm sorry to do that to you, it's only because I know we only have you for a short time. May I just invite you to say, how do we disrupt these silos, these false separations between us in order to get to a more powerful solution to what we're facing?
Well, I think the first is, again, just repeating some sort of first principles of feminism, if you like, and also first principles of human rights practice. And that means listening directly to the voices of individuals. I think when we're working with women, that means listening directly to women, not to representatives, whether they're parliamentary or otherwise, whether they're from community leaders, but you go directly, you have to hear and you have to learn from experience. I think a young friend, I think, said it well. We don't want to see tokenism. There's a lot of it. It's not just young people, you'll be happy to know. It's not you guys only who get tokenized. Women have been used to being tokenized, even as the women's agenda has come to the forefront. We've seen much more incorporation, but still the same old practices find their way in. And I think that means if we hear from experience and build systems around that's the way we're going to have to work. And that means, if I can give a concrete example, and I'm really delighted to hear Dr. Sam, I think what he said just now, that is absolutely right. We can all say no more business as usual, but what does that mean? It means starting from the bottom, hearing those voices, seeing who's being left out and how, and bringing them back in. And I think that means that, we understand the climate as the huge crisis in front of the world. Conflict didn't just go away. We just saw it hit us in the face. It's hitting us in the face today. Everyone who's in COP, half of them are not going to talk about the conflict that's going on 2 minutes away, with Gaza being pounded. We have to use these words, and we have to hear voices, and we have to reflect them. And that means we have to confront challenges. It's easy not to use some words. It's easier for most of us, particularly those of us who are working, I think, in the global south, to put our heads down and say, okay, let's just get on with my little area of the world. I think our first speaker, Dr. FIFA, put it brilliantly about siloization. We are completely compelled most of the time to say, let me stay in my groove, let me stay in my rut, do my piece. If I put my head up, if I put my hand up, I'm going to be shot down, right? Literally, that's happening to some people. But for other people, it means not being able to do your work. So I think that the challenge is, how do we do that? How do we hold hands across this space? And how do we support those we are working with, but also continue to work ourselves? And if I just could take a moment, Kate, I think you flagged this up at the beginning. I think this issue around, again, universalism means that we can't just now embrace the space around economic and social rights. We have to remember civil and political rights are part of the battle, right? We had this, we had 20 years, 30 years fighting to put economic and social rights back on the agenda. It's time to remember the rest is part of it. And if we just say we're going to have, again, development, we're going to have climate change fighting, but we're going to see our judiciaries collapse, we're going to push women into the informal space, saying, oh, you can't get anything out of courts, forget it, just use apps and go into community spaces and do what you can. That's not going to give us all of the answers we need, because the basic standards that we're trying to apply need to be progressive, not regressive. So community spaces can be enormously empowering, but they can be empowering if they build everyone who's vulnerable, everyone who's marginalized, everyone whose rights are being trampled on, if they're built into that community, not if they're asked to have their voices, their experiences represented by others.
Very powerful and very important messages, Sarah. Thank you so much, including by challenging us to think about indivisibility as well as as well as universality. I beg your pardon, as a key pathway to addressing inequalities, and that's the understanding that civil and political rights must be blended with economic, social rights if we're to address inequalities. But may I go back to the panel? If you think about disruption and you think about leapfrogging past this sectarian approach that we've all developed in regards to both knowledge, intervention, and norms, where do you see opportunities for disruption? FIFA, can I bring you in, please? Over to you, ma'am.
Thanks so much. So opportunities for disruption, and I want to focus on what you that one word you mentioned, knowledge. And I think that the way to disrupt these silos is through data. And in the report that we're publishing this week on gender and COVID, there are numerous data sources that can be cited in numerous meetings on how we need to change our approach to pandemic response, but also any medical countermeasure response. So you've got 55% of the population in Somalia that are nomadic at different types of a year. So don't you think that enforcing PCR for COVID on these populations, when you know you can't return the results to them, is an idiotic way to approach things? Another thing is that when they rolled out the vaccinations in South Sudan, they rolled it out in hospitals, main hospitals, in knowing that women still need to ask permission from males to access vaccines. And then they were like, oh, how come that that out of all the vaccinations provided, 70% or more were males? So we need to be driven by data. And we also need a wider definition of what data constitutes. So in a lot of the high-level pandemic meetings that we had throughout the COVID pandemic, it was predominantly white global North people in these rooms, and folks saying, oh, we need community engagement only as a matter of ticking the box. And what Dr. Sarah said was so important about ensuring we're listening to women and gender diverse communities, because they possess data. This whole notion about data being only within the confines of a randomized control trial is madness, is myopic. It's not going to serve our purposes. So we need to start looking intersectional and having a wider definition of what data constitutes.
Absolutely brilliant. Thank you so much also for disrupting our ideas about data and evidence and where authority lies, in fact. Adila, and I want to come back to you because it strikes me that that's exactly where we left you, heading in precisely that direction. And I wanted to give you a chance to talk about your ideas of disruption. So back to you, sir, please.
Thank you so much, Kate. And I think I really want to emphasize on meaningful youth participation. I think the framework of Roger Hart's ladder of children's participation needs to be a framework that is sort of spread out to every single person in this room, to know the 8 levels of children participation, of young people's participation in projects, in advocacy, in democracy, in climate action, and so on. We don't want young people to be tokenized, manipulated, or ill-informed. We want them to have co-design a decision with adults, to initiate something with adults. I think one of the things that was said by this really popular Vanessa Nakate, a popular climate activist, is that we've been told to have a seat at the table, that it's great to have a seat at the table, but sometimes young people can create their own tables. And I think this is a point of disruption as well. We are seeing more young people in Malaysia, at least, wanting young people to be institutionally or formally be a part of the government's decision-making. Only this year, the Climate Change Advisory Panel now consists of maybe 4 to 5 youth NGOs. So that's great progress as well. But we want to make sure that those kind of decision-making processes are meaningful, that we are not there for photo ops, that we are not there for one-off engagements, that we are not there for just a speaking engagement. We're there to constantly engage with different stakeholders. And I think one point of formal disruption that a government or an institution or an agency can take is basically having a youth focal point to COP, to any conference, whether it's on health, gender, or climate change, to have one formally or institutional youth focal point to go to these events, to bring back data, to communicate, to become a diplomat or become an ambassador of that agency or institution or that country. It's a great opportunity for us to acknowledge that young people have this really important role to play, to participate in decision-making when it comes to different issues like climate change. So this is some of the things that we've been championing here in Malaysia, particularly to UNICEF, for Malaysia at least to have a climate change council on children and youth, to have youth-based initiatives and youth-led as well to promote stronger climate action. Because in this, it's also worth acknowledging that a lot of climate change disruptions, protests, petitions, action points are being led by young people, and yet we receive the least amount of funding. We are constantly tokenized. We have logistical and financial troubles accessing conference of parties under the UNFCCC. So these things need to change systematically. And for me, having a youth focal point is a tangible solution where governments, agencies, NGOs, or institutions can collaborate and meaningfully engage with young people by saying that we have a formal position of a youth focal point that wants to engage with different issues.
No, that's absolutely perfect, Adele. And looking to both Sam and Stella now, I think we've heard a call powerfully for a disruptive paradigm, disruption of authority, and it specifically where authority is wrongly concentrated currently, global north, white, old, male, and old white women. We've heard for a disruption of notions of authority and contribution, a disruption of drivers of data, now a disruption of mechanisms of change. But how do we get to this disruption of power and investment in disruption when perhaps those who hold power are going to find a serious conflict of interest in that disruption? I think that's what Adele is also saying. Sam, Stella, which of you would like to? Stella, please. Perfect. Go.
I think the first thing that we have to holistically, whatever context you're working in, we have to change our practices, and our processes in multiple ways. And Sam had already alluded to some of the philanthropic practices that really need to change around shifting power, because part of shifting power, the analogy around shifting power is letting those with lived experiences be able to speak, to lead in interventions, and to be able to find innovative ways in which they do this. And Rahman has spoken about something very important around data. And for me as a scientist, one of the things that the center is doing is to be able to gather what in our world we'd call it anecdotal data, which literally is lived experiences of communities around whatever issue, and respecting that as literally evidence to be able to lead into change. If you're talking about policy, legal, if you're talking about community behavioral change, communication interventions, you have to really respect that in terms of data. So our cities are amazing, fantastic, but also community experiences are also amazing. And we need to take a social approach around data. The other thing that I'm also I also want us to just think about in reframing is how it is that we are approaching the issues that are the polycrisis. Again, I cannot emphasize more the issue of around intersectionality. What's happening right now in the Middle East, family planning is being disrupted, vaccination for children is being disrupted. We are destroying healthcare facilities, right? And those are things that are very critical for us to speak about and to have honest conversations around what conflict does and the implication around public health and global health interventions. The other thing that we also have to understand is that it's important to always, at the end of the day, centralize women and gender diverse persons, in interventions, whatever interventions. And we continue to make a lot of noise in global health saying that we only have 25% of representatives of women, in very high positions. The other day, a WHO analysis was done, and it was a dismal number, less than 40% actually around women who are making decisions around their health. And yet, you look at the burden of diseases, is that women and girls and gender diverse persons carry a huge burden of diseases. So we must be able to think about. And finally, the disruption is around accountability. And Sarah had already spoken about, we have international norms and standards, right? There has to be ways in which we hold people accountable on CEDAW, we hold people accountable on Maputo, we hold people accountable in international humanitarian law, especially right now. People have to be held around the rapes that are happening in conflict areas, around the maiming of children that is happening in conflict areas, around the disruption of education facilities in Sudan, in DRC child labor. We need to be able to hold people accountable. Because if we don't hold people accountable, we don't hold the duty bearer accountable, then everything that we keep saying is going to be lip service. So there has to be strength, a strengthening way in which there has to be a way in which we strengthen our accountability frameworks.
My goodness, Stella, I hope you end up somewhere near as Secretary General of the United Nations. Actually, I think it would be a great asset to, to the world of disruption that we seek. That was superb, if I may. Sam, can I bring your voice in? Because, you know, that serious disruption that our wonderful colleagues have described together, if we add it up, it's a powerful program of radical change. How do we take that forward? I mean, how do you see it from your standpoint?
Yeah, no, brilliant intervention, Stella, and thank you, Kate. I think, like I alluded to, we need to disrupt the funding model. Now, who initiates that disruption? I think, as Shaya Bimbola says, there are different ways to storm a castle, right? Some of it will be self-initiated, and we're already seeing some funders making some change, and others will be just demand from the constituencies and pressure from the constituencies that the funders serve. But I think that one thing that funders need to do is to move away from what I call programmatic solutionism, right? You know, whenever there is a development challenge, we create a new program or initiative, we dump a truckload of money into it, and 5 years later, we move on. And don't get me wrong, when there's an acute need, it is kind of okay to get into a silo and try to address that problem as quickly as possible. But this should be the exception and not the norm. And yet this is what funders tend to do. For example, we're all excited about the Health Day at COP28, but I'm already seeing a bandwagon effect. More and more funders are jumping into the space. Now, if you work at the intersection of climate change and health, that's probably great news for you. But if not, you must be thinking, here we go again. Which areas of global health are going to be neglected as funders turn their attention to this shiny new issue? And given the tendency of funders to be reductionist, are they really going to embrace the complexity that the climate health nexus demands? Are they going to recognize that the climate crisis and its impact on health is an aggravator of nearly all the other crises facing the world? Or are they just going to lower their ambitions and aim for quick wins and low-hanging fruits and such? So we need a disruption. And I think one way for that disruption to happen is that funders need to give up power. And for them to do that, they need to focus on empowering problem solvers. And by that, I mean, we need to strengthen local institutions. We need to strengthen people and communities to be able to adapt to the resilient, to adapt and be resilient to the multiple crises facing the world. And how do they do that? I think at the minimum, we need to start writing blank checks. I know it's not a popular thing to say, but I think it's something that as funders, we need to do. We need to start writing more blank checks to grassroots organizations. We need to give more endowments to women's rights and youth-led civil society groups. We need to give more core funding support to indigenous researchers. We have to give up power. And I think that's the only way to sustainably build the resilience of local communities, because there will always be crises in the world, right? There will always be different kinds of crises. And so we need to empower people. We need to invest in empowering people and institutions in the long term to be able to face and adapt to these crises, whatever they might be.
Sam, it's like listening to beautiful music to listen to you. It is indeed music to our ears. I think I've never seen a panel react so well to the idea of blank checks. In all seriousness, it's a very profound contribution you've made, and you've identified a key demand, if you like, on ourselves as we think about realizing, bringing into reality this disruption. Dear panel, if you were to join Sam in identifying your top demand for where we could, for action or priority or approach, a top demand for greater collaboration, for releasing potential closer to where people are living the day-to-day realities of polycrisis, what would your top demand be? Is there anyone who'd like to kick off a top demand, single thing that you think could really start this catalytic process of disruption and reconstruction.
So let me come in on that.
Perfect.
I think the top demand is we need to stop having meetings in the global north, and stop completely, because once we get people out of the global north and into places, convening spaces, tables in the global south, then we get a lot of more opening to talk about intersectionality, whether it's race, whether it's gender, whether it's whatever it is, migrant status, all of that. And it opens, it allows for a lot more flexibility in how we think about things. And coming from a pandemic space, I can't tell you the amount of meetings I've been in where they've been saying we need more emergencies capacities across Africa, which always makes me cringe a little bit. And it's not just about emergencies capacity. We need gender experts in every single room that we have in the pandemic space, whether it's the R&D, and folks in the R&D groups always say, oh, well, why do you need gender experts in R&D? And you're like, did you see that Paxlovid was never tested among pregnant women until there was so much pressure on it? Like, people are still saying, why do we need gender experts in an R&D group? And look, you need gender experts in R&D, you need it in delivery, you need it in everything pandemic related. And having folks still say we need more emergency experts across Africa makes me want to throw a shoe at them. It's just kind of crazy at this stage. And I think being siloed in the global north and having these meetings in the global north is the seed that kind of prevents minds opening and making sure we go intersectional.
Yeah. And somehow it's very connected to accountability. That proximity matters, because I think you've also challenged us, how do we as civil society actors or as academic experts, as practitioners, not get drawn into being pointed to a space that calls itself global, which is in fact so not global as to be exclusively North and West, and even then elite and particular. Stella, I just have to hear from you again.
But as Pipa was speaking, I was writing two main points. And one point is that we have to really embrace a society of goodness, and the goodness is actually anchored around equality, democracy, and sustainability. And the second point is that we need to really expand our horizon to start looking for a catalyst of change beyond money, and instead invest in trust, invest in empathy. We'll stop the wars, invest in knowledge sharing, invest in building movements for social change within the societies. It is only within that, it's only when we invest heavily in the core and the ingredients that strengthen the societal fabrics that we are able to see the change that we want to and anticipate in terms of gender.
Stella, that's brilliant. Ideal. Can I bring you in? I think there's a powerful connection between location, and young people. 90% of the world's youth today live outside the global north, and youth is not a minority status in many countries. Youth are in fact the majority, but locked out from the tables of power and decision making. When you think about your top demand, what might that be?
Thank you so much, Kate. And I think this is going to be sort of like, understanding what the right kinds of definition of a youth is. I mean, the UN definition of a youth is 15 to 24 years old. So that means my youth days are expiring next year, right? So but it's also that, I mean, like in Malaysia, at least the youth definition is 40 years old. It's people under 40 is still considered youth, and that's insane. And they're trying to sort of like reframe it to 30 years old by 2026. That's a few years away, right? So I think that's really important to understand the sort of age limits of what constitutes a young person, right? I think the UN definition hits us right, 15 to 24 years old, right? Like I mentioned before, having a youth focal point is really important for events like this, for agencies, governments, for them to network with different spaces like COP, other conferences on other issues as well. But it's really important for, forums or speaking engagements to be intergenerational. I think that's really important for to have a young person present, which is, I'm really grateful to be here today, but also to make different sessions, future events under your organization, to have an intergenerational speaking session where there are people from different generations with diverse experiences as well. I think that's really important. We want to make sure that that is something that organizers really think when it comes to the forums, the webinars, and other events as well. But going back to my initial remarks, it was just having a youth focal point is so important because it determines that young people have a formal position, an institutional position to sort of have influence over policy making, over legislation, and I think that is an important starting point that any organization, any company, any country can make. I think we have this misunderstanding that young people, that adults tend to sort of not respond to young people because they think that, I'm really scared to leave young people in the room, even to paint a mural, I'm really scared they'll mess it up and so on, right? So, but I think adults have to let go of that fear, that young people have this maturity to seek advice, to receive mentorship. I think adults have to let go of that fear that young people can't paint a mural or can't co-design a climate change policy.
Thank you. And in fact, Sam, when I think about what Adil's saying, and I just recall the median age of Uganda is 15. The median age of Central Africa Republic is 17. I mean, these are not minoritarian demands. What Adil is describing is both a majority interest, but also the importance of transition out of an aged domination of power and authority. What do you think funders might be able to do to advance the agenda that Adil had just put on the table, that everybody should have a youth strategy and youth representation at the heart of their response to such as the polycrises?
Yeah, no, it's an excellent point that Adil makes. And I think my top demand for funders will be to embrace authentic allyship. We tend to talk about authentic allyship at the individual level, but we don't tend to often talk about it at the institutional level. And I think that is what funders need to do. And so what does that mean in real terms? It means that funders need to unlearn a lot of things that they think they know. A lot of times, I feel that there are so many uncontested assumptions that we have in our business models and business practices. And we never really challenge those uncontested assumptions, right? For example, when we talk about, the lack of capacity among young people or among people in the global South, is there really no capacity, or have we just invisibilized this capacity, or have we elevated all other kinds of capacity, what I call elitist intellectualism, for example, over indigenous knowledge, over knowledge created and generated by young people? So we need to we need to unlearn a lot of the things that we've learned and learn new ways of doing things. And like I said earlier, we need to give up power. We need to listen better. It's funny that a lot of times when I'm in this forum, that's where I really hear the truth about, what needs to change in the philanthropic landscape. And we need to play the long game. I think that's my parting shot, so to say. We need to play the long game. And I'm so proud of the organization I work for. For the first time in our history, we have a 10-year strategic plan. It's not often that you hear organizations or funders doing that, because we recognize that we need to stay the course and look long-term, because a lot of the problems that we are trying to deal with require long-term thinking. And if we focus on the youth, like Adil mentioned, if we empower the youth, then of course we have to stay the course with them until they find solutions to their own challenges.
That's brilliant, Sam. I'm just going to ask you to stay at the microphone, if that's okay. I mean, I want to pick up on and really reinforce this idea that today youth is a competency as well as an identity. And it is a competency oriented to the future that those of us much older simply don't have. And I think there are many dimensions to it. And I so appreciate you also disrupting our idea of what is meritorious, what is competent, what is expertise. But there's a real interest in the audience in blank checks. I mean, you would imagine this. And it strikes me that it'd be great to just hear from you and then have panel members react to this. How can we help you and help funders unlearn and come to this point where checks might be written with a little less baggage and heaviness and a little blanker than perhaps they are written today? What can we do to help that unlearning and that disruption?
Yeah, no, that's an excellent question. And I think because the funders hold the check, so to say, the best I think we can do is to make that demand and to put pressure on them and to show them that there are examples of where blank checks have been issued and the world did not end, right? We all know about Mackenzie Scott. I always give this example, her example, whenever I'm talking. And she's given, unrestricted funding to thousands, worth billions of dollars to thousands of organizations around the world. And I often joke that, well, it's not like, I mean, I know two of those organizations here in Africa, and it's not like the executive directors of those organizations went and bought Lamborghinis and private jets with that funding. So what is our paranoia about due diligence and about micromanaging and about dictating the agenda as funders? What is this obsession, right? If we truly want to be authentic allies, we need to step back, right? And really enable those who are on the ground, who know what the problems are, right? And who have, for all intents and purposes, demonstrated a track record to be able to determine the agenda and to do that work. And even for those that don't have a track record, let's say it's like young people who are still starting out, there are creative ways of engaging young people and getting them to work accountably in a specific space, whether by partnering them with more mature institutions or grassroots organizations or civil society organizations within their space. So there are ways of doing this responsibly. And I just think that we, as the so-called beneficiaries of funding, need to demand more. And hopefully some I don't think that all funders will respond, but I think that some funders will.
Absolutely brilliant. Thank you so much, Sam. And my goodness, thank you for being a disruptor in this way. It's exciting to listen to. Stella, how can we build on the opportunity that Sam identifies? And what does it prompt in you, this idea of being able to disrupt the political economy underpinning the problems we've been identifying earlier in the conversation?
I'm very privileged to have a background in philanthropy, so maybe I could throw in one or two words around that. I worked for an activist-led public fund, and one of the things that we literally got our hands off is that we never dictated how the resources would be. We actually used a participatory methodology in grant making, and part of it was to bring the activists, the practitioners together and ask, how would you want these resources to be utilized, and how do you want to distribute these resources? And part of the learnings that we actually found, and we did this within the African continent, moving about $10 million per year, is that hearing the voice of those who are with their lived experience is very powerful, because what it is that they became innovative. They had more sustainable strategies around mitigating some of the challenges that they had. And above everything, it actually gave a very good platform for peer-to-peer support and peer-to-peer network building. And so there are means and ways in which those who did work around the same thematic area would come together to share best practices. They would come together to even share some of the strategies that they use in terms of programmatic work, but also to debrief, And the other thing that I also some of the lessons I also learned is around the biases that we have around capacities, as Sam said, is that we assume that just because it's a nascent organization, it doesn't have capacity. We cannot do that, We have to be able to respect the autonomy of these organizations and to trust. And that's why I said the world needs a lot of trust and empathy as part of practices, for example, in philanthropy. And finally, the other thing that we kept doing around convening is that it's important to also convene philanthropies. Is they also work in complete silos, Right now, everyone is excited about climate crisis, They're forgetting that GBV is still in there. Disruption of food security is still in there. And so they have to come together. And I loved some of the funder practices where they would say, oh, we are collaborating with this other funding organization. We have this support. We want to give, for example, the Black Feminist Fund. We want to give these institutions within the continent. Can you guys come together and find means and ways of utilizing these resources as intermediaries within the communities? And I found that to be very powerful. Where I am now sitting, and I see that in communities, is that they're fantastic grassroots organizations. The capacity that we're giving them around disrupting gender in health systems, disrupting gender within the legal frameworks, it can only do so much without the resources that they need, because nobody is listening to them. They don't have the privileges of legal recognition, and yet they are doing fantastic work. So those are the things that we need to get out of the way if we really need to see the change that we need to build within the world.
Magnificent. Thank you so much, Stella, and for continuing to inspire us. FIFA, I just, listening to Stella and Sam, I wanted to get your advice actually on an issue that's always troubled me when we've got to this point. Evaluation and assessment and review has had such a grip on funding and analyses of funding, and often forcing us into a sort of a distorting metric of measurement rather than one that actually tells the true story. And I just wondered, what does it generate for you, this conversation around how we could build greater trust and respect from funders that can we use data to help us in this regard, but not the sort of data that makes us use false measurement and close our eyes and ears to the voices of the people that you were rightly putting at the center of your earlier remarks.
Thanks so much. Yeah, I might repeat myself here, but it really is about having a different understanding or wider understanding of what data you prioritize. And throughout the pandemic, we saw so many organizations say things like, well, we don't have data on self-tests being deployed in Africa. And you're like, how long do you think Africans have been using pregnancy self-tests? It is a very rigid space of how data and evaluation is considered, and the value placed on qualitative data, on social listening. And this is one good thing that UNICEF did, for example, through the pandemic, which was they called it social listening. I just call it talking to my Black and brown friends, which wasn't done enough in the pandemic space, which was predominantly white, because folks didn't have enough Black and brown friends. So if you want to call it social listening, let's do that, and have more qualitative information informing our paradigms. If you're going to wait for randomized control trial on specific self-testing for COVID in Africa, it's not going to happen. And people need to unlearn that condescension that perhaps exists since, has seeped in through living in systems of white supremacy. And this idea that women who have been using pregnancy self-tests for decades wouldn't know how to use a self-test for COVID is insane. So we really need to start with thinking differently about data and valuing qualitative information in at a higher level.
Power on. Connected.
Oh, FIFA, thank you so very much. I wonder, dear panel, listening to this and the transformative, reconstructive power of paradigm shifts that you've detailed and the practical, achievable means by which that disruption could take place. Tell me, why has there been so much pushback, so much organized opposition to gender, not only to the common understanding of perhaps of gender equality with which we're more familiar, but I think Stella talked very, very much about gender diverse persons and challenged us, I believe, to open up the lens of gender, and that's where Adil, you were taking us as well. But it does strike me that if you look at the legislative agenda of governments the world round, and you listen to the public rhetoric of leaders the world over, and they're to be found in every region, there's actually regression, not advance, of commitment to gendered equality. And why is it in the midst of polycrisis, given the power of gender, addressing gender inequality and the power potential of disruption, why is it now that we're seeing such opposition coming to what needs to be done to make equality truly inclusive? Adil, is it fair? Can I don't know if you have any thoughts about this, the sort of renewed life being given to homophobia, to transphobia, to sexism. Have you seen this, felt this yourself?
Yeah, I did. I think that as a queer person, I've been, sort of like in this space of climate justice activism. I've been rejected opportunity to speak at engagements because of my participation in LGBTQ communities. I've been sort of like not given, funding or great career opportunities or development capacities because of my identity as a queer person. But the pushback here, I think it's so, because when we look into it, right, in Southeast Asia, it's such a queer, diverse region. Historically, culturally, we've had, shamans in Borneo of Malaysia who change genders to accommodate to their gods and goddesses, right? So those lessons have been sort of like displaced or forgotten in the context of Southeast Asia today because of different interventions of history. For example, like colonialism, the introduction of the penal code to sort of criminalize homosexuality left by the British in Malaysia, Singapore, and so on. So those have sort of like left very painful remnants in society where, the civil court can sort of pursue a criminal case against a gay person, against gendered minorities, right? So as long as those laws exist, it teaches the community, the society, that these individuals, this community is worth criminalizing. And I think that's so heartbreaking. What's come out of this is the most beautiful amount of resilience that trans people have, that queer people have out of these devastating scenarios. You see stories of trans women in Indonesia braiding each other's hairs, putting makeup on each other in flood shelters. You have gay men in Philippines creating map systems to find different HIV facilities or flood shelters that are queer friendly, or safe houses for queer people in the Philippines. You see NGOs in Malaysia building back stronger to accommodate safer systems for queer people. The resilience of queer people has always been so beautiful amidst all this heartbreaking scenario situations, whether they're legal frameworks that hurt queer people, or whether they're just cultural or religious norms that sort of have very different views or painful views on the queer community. But I think what's to come out of this is so optimistic and so beautiful. To me, there are lessons that we can adapt in climate change mitigation and adaptation. Things as braiding hair and putting makeup can be as therapeutic. It can be mentally, in terms of mental health, it can be so supportive that queer people are pioneering. Their involvement in informal work, such as street performance and music and dance, it's therapeutic and can be adapted in flood mitigation and flood adaptation. And I just wanted to point it out that amidst all this painful situations that's happening with queer people worldwide, especially in Southeast Asia region, a lot of resilience has come out of it. And I think climate change scientists or policymakers can actually take lessons from these kind of stories.
Yes.
Beautiful.
It's fine. So this
Sorry, Pascal,
Yeah.
you're unintentionally, I think, unmuted. But I wanted to, because I wanted to bring in Stella here. Stella, I'm imagining this is something you are familiar with in ways that you wish you'd never had to become familiar. And it's wonderful to have you take the floor. Thank you, ma'am.
You know, Prof, when I think about the opposition, you know, if you look at it over the last 20 years, it has been very concise, very organized, and very well coordinated, very well funded. But it has been multifaceted. It has been anti-gender, anti-rights, and finally anti-democracy. And the conservatives that have built this movement have built it, financing it on the backbone of religion, on the backbone of culture, on the backbone of patriarchy, on the backbone of capitalism. And I say this because if you're looking at ways in which feminists have been able to call out capitalistic practices, call out patriarchy, you know, and all its isms, sexism, you know, ableisms, it has actually disrupted the labor workforce because they've always been extractive, ways in which they extract from vulnerable populations, from Black communities, from gender diverse persons. There have always been an extractive way of working. And so part of it is that their comfort has been disrupted, and part of pushing back is to be able to take things to status quo. So ramifying our cultural beliefs, which I don't know since when the world had a homogeneous cultural status. We don't have. We are completely heterogeneous world with different values and experiences which are beautiful, and they bring color to the world. Look at the abortion rights pushback from Roe versus Wade. It's already getting into our region in the African continent, where we are not talking about the conversation about reproductive rights, access to contraceptives, access to comprehensive sexuality education, access to safe abortion, are actually literally being silenced. And silencing is through legislative ways. You know, we are having right now, Uganda passed an anti-homosexual law. Kenya, there is a law called the Family Protection Bill, rather not a law, a bill, that part of it is being discussed around the family values, rephrasing it around reproductive rights. And it's not just about LGBTIQ persons, it's actually around women's autonomy, you know, agency, self-preservation, choice, you know, all of them are around that. And part of it is the subjugation of women in all their diversities. And that is a push that we are seeing in all different sectors. We saw what happened with Roe versus Wade, even during the Harvard challenge that was in the Supreme Court around inclusion of people of color, you know, and those things that are happening in other jurisdictions globally, they're actually even affecting us. And so people are asking, the same question is asking, why do we need women in leadership? Why do we need to shift? Why do we need to have a quota system around inclusion of women in terms of career progression in research and development? You know, why is this very important? It's actually important because we bring in not just our empathy or love, but we also bring in the lived experiences and biases in research and development that would not necessarily be seen. And so this pushback has to be attacked, not and monitored, not necessarily from just a gendered lens, from also a democratic lens, but also from a human rights lens. Thank you.
Absolutely brilliant, Stella. What Stella's reminding us is that the opposition is very synergistic. It absolutely understands the intersectionality of sexual and reproductive health, of gender equality and democracy, and is undermining democracy via the entry point of the things that we hold dear and that are allegedly universal norms, standards, and promises actually the international community has made. Sam, when you hear of this malevolent philanthropy, because that's what it is a flow of funds from certain quarters of the global north into the hands of others outside the global north, designed to erode democracy. I mean, what does it make you think? How do we hold funders in this of this kind accountable? What are the challenges, and what can we do to at least expose it and then challenge it?
Yeah, I mean, if I can summarize what I gathered from Stella's intervention, privilege fights back. Privilege always fights back. And because privilege has been entrenched for centuries, because privilege is well-resourced, it tends to be well-organized, and it tends to be quite effective in achieving its own goals. And for us as funders, and that's why I think in my very first statement, I mentioned that a lot of the influential funders are domiciled in the global north. And what that means is that they operate from a position of privilege. And that's why I'll repeat what I said, that it's critical for funders to lean out and begin to focus on empowering people who are in the context and who have the needs and who can now begin to take up on these issues and fight back. Defining the parameters of fighting back, defining what needs to be fought back on or about, I think is a model that is just no more fit for purpose. I think now we need to focus on empowering grassroots organizations and women rights organizations, truly empowering them, playing the long-term game. And I think the benefit, because one sort of pushback I always get when I talk about funders in the global north, for example, giving a power, is that we often ask, well, where are the funders in the global south? For example, why are the governments not investing in various civic spaces, etc.? Where's the local philanthropy? And there's a whole political economy argument around it, and I wouldn't go into that. But what I'd say is that if we focus on empowering organizations and having a long-term view, then my hypothesis is that eventually those grassroots organizations, those youth-led groups, those women rights groups, eventually they'll get to a point where they're not only holding the global north accountable, they're also holding their own governments accountable. Because I think at the end of the day, we need to find balance, because the erosions that we are talking about is not just driven by global forces. They are local forces, they are sub-regional forces, they are national forces that are driving a lot of the rollbacks that we are seeing in different spaces. And so we need to, for me, I can't emphasize it enough, the focus of funders needs to be on sustainable empowerment. I think that's the only, we need to get out, we need to put ourselves out of the picture and make those investments. Thank you.
This is magnificent, Sam, and I think you're also challenging us to think about the aggregate outcomes of several donors and several funding streams and several things. FIFA, before I go back to Sagri, you're going to summarize everything, I believe, Sagri. Before I go back to Sagri, if you were to say, look, muscle up, people, understand that privilege will push back. What is your real request of us all, having heard all these interventions? Over to you, FIFA. Thank you.
Thanks. I think we're all quite vocal, but be more vocal is probably the center of it, and be vocal in different spaces. And I know I'm predominantly a pandemic space, but I suppose I'm privileged to be a consultant, and I'm able to be in spaces that talk about period poverty, about gender-based violence, about climate, about different places. And I think we're always a little bit hesitant to speak about intersectionality sometimes, because we worry about the white lens being discomforted, and we need to be brave enough to do that in all spaces. And it even happens to me, and I don't normally have a filter about these kind of things. So I think keeping up with saying the same message in multiple different forums is essential, and insisting on gender in particular, being in that R&D space where loads of people don't think it belongs, and not just the R&D space, but that's just a metaphor. So I do think consistency is key.
And I think, dear friends, FIFA is really challenging us all to not only think disruption as an intellectual exercise, as important as that is, but it's new posture, it's new voice, it's new attitude, and it's new courage. And it's in that spirit that we just celebrate you as a panel and the great gift of the conversation. And I go back to the wonderful Sagri, to whom we have to say thanks for giving us this privilege. Over to you, Matt.
Great. Thank you, Kate, for that excellent moderation. And thank you to the panel for just a wonderfully rich discussion and so much food for thought. We don't have a lot of time. We've reached the limit, but I did want to point out a couple of things in just summary. I think it's very clear this panel is bringing out a clarion call for all of us to disrupt the patriarchal foundations of how we approach the prevention, mitigation, and response to polycrises. We need to have a disruptive paradigm that looks at disrupting authority, disrupting knowledge hierarchies, the mechanisms by which we do our development work, whose knowledge is privileged, and really, as many pointed out, giving up power in an effort for reconstruction. Some very clear solutions emerge from colleagues, and we need, I'm sure there are many, many more. We're looking at focusing on lived experiences, speaking up and sharing solutions, acknowledging, as Adil said, youth as a resource for today with existing expertise, following up with FIFA, who said gender is an expertise that must be considered, and Sam, who talked about unrestricted funds and creating allyship. I was struck by Sarah Hussein's point about civil and political rights need to be upfront with social and economic rights, and that development without democracy is just not possible. We've talked about health equity as a blind spot, as Stella very rightly pointed out, noting that biomedical interventions are not enough. We need to privilege the experiences, voices, and the solutions of those who are most impacted. And finally, the two other points that I thought are really important to resonate is Sam's point about funders, authentic allyship, needing to play the long game, needing to disrupt the way they do their work. We cannot have business as usual, and how we can, as a collective movement, including empowering grassroots organizations to push back, to encourage funders to apply a different approach in their funding games. So I'm going to stop there and just say thank you very much. This was very rich, and I am sorry I'm not able to fully sort of complement it, but thank you all for an excellent presentation, and what a great way to end the 3-day virtual forum. Thank you.
Thank you, the interpretation team. I think you probably had a better journey that time in terms of pace. I think we can't hear you, Elena, because you're in the sign language. Oh dear. So, yeah, thank you all. Thank you, Lisa.
Just going to put the stragglers in the waiting room and stop recording.